Hey guys, this is Dr. Nelson here with Trinity Orthodontics. So I have been getting a lot of questions from patients and parents recently about Invisalign treatment for young kids. Sometimes it's necessary to do orthodontic treatment on little kids that are usually 8 or 9, sometimes a little bit earlier, but usually seems like 8 or 9 is kind of typical. So fourth grader, third grader kind of age. And Invisalign is amazing for those kids because they are unbelievably cooperative with wearing the aligners. And from a parent standpoint, it's awesome because the aligners are pretty comfortable in comparison to putting braces on the teeth. So if you've had braces on your teeth, you know that they're not super comfortable. So Invisalign aligners put a little pressure on the teeth. So when you first put them on, they feel a little bit achy. But usually that lasts like through the night. So we always tell our patients to put their new aligners in before they go to bed, so they feel a little bit tight and maybe a little achy when they first put them in. But then by the time they wake up in the morning, everything's good and it's not really a big deal. But it's super nice with little kids because there's no breakage. With braces with little kids, there's a lot of breakage. So every time the braces break, then you've got to take them out of school and go to the orthodontist and get things fixed. And it's pretty high at the beginning of treatment while the kids and the family's getting used to getting braces and watching what you're eating. So it's super appointment intensive to have braces on. And with Invisalign, there's really not much to break. So you don't have all the appointments. You don't have kids that are crying and upset because their teeth hurt like crazy. They can eat whatever they want because they just take their aligners out, or they can leave them in. So you can eat with the aligners into it. People are kind of surprised to hear about that, but I actually encourage that sort of behavior. And they are super clean because when you want to brush and floss and do whatever you need to keep your teeth clean, just like take them out and do it like you normally do. So obviously you can't do that with braces. So this is the other thing. A lot of people are coming in talking to me and they're like, well, we went and saw 3 other orthodontists and they told us that they can't fix this problem with Invisalign. And my answer to that is true. They cannot, but I can. So doesn't exist that I have run across yet an orthodontic treatment or an orthodontic problem that I cannot treat faster, more efficiently, with less appointments than I can do with braces. So we're still amazing with braces at our office, but this whole sort of concept of you have to be a candidate for Invisalign, that doesn't exist in my office. So quite honestly, in my office, what does exist is that you have to be a candidate for braces. So the treatments that I do for people who have really complicated orthodontic problems, I do not give them the option for braces. They have to have Invisalign treatment. So that is typically the opposite of every single doctor that you're going to run across, because they don't know how to use Invisalign to the same level that I do, because they just are not as passionate about learning how to use Invisalign. So when you go to an orthodontist, they says, well, we can try it, but we might have to put braces on at the end, or I just don't think that you're a candidate for Invisalign. Anything that they're telling you that, well, I'm not sure about Invisalign, this is what they're really telling you, is like, I'm not that good at Invisalign to treat your case. That's what they're saying, because Invisalign is just a tool for moving teeth. Braces, they're just a tool for moving teeth. There's all kinds of different ways. There's special kind of removable appliances that look kind of like the old style retainers. You can move teeth with those. There's so many different ways that you can move teeth around, and they're all in our toolbox of what we can use to move teeth around. So my favorite tool is Invisalign. So I have trained myself and my staff to a super, super high level, so that really we can treat anything with Invisalign, and we can really, quite honestly, do it faster and better with less appointments. than we can with braces. So be sort of aware when you are talking to other doctors or other people or friends and neighbors, and you're saying, well, we're thinking about getting Invisalign, and they're like, oh, I heard it doesn't work. That's true. Where they went and their experience with Invisalign, it didn't work. But I can guarantee you it's going to work in my office because that's what I do. I study it. I'm the largest provider in the Rocky Mountain region, so I have lots of experience with Invisalign. I've treated patients as old as 92, so that patient's going to outlive me probably. And I have kids as young as 5, believe it or not, that we're treating with Invisalign. So it doesn't exist really in the world today that you have to be a candidate for Invisalign. If you have to be a candidate for Invisalign at an office, then I wouldn't go there because they're telling you we're not that good at it. I mean, we might have to finish you up with braces because we just don't know how to finish it up with Invisalign. So if that's the case, I would get a second opinion. Come see me. We do all of our new patient consults are free of charge, so you can come talk to me, and I can tell you what we can do for you with Invisalign, and I think you'll be happily surprised that we can do some pretty amazing stuff for you. So anyways, just wanted to talk about that because I had some moms in the other day and they said, why don't you do a video about Invisalign because all these other orthodontists are telling this can't be done and you can't use it on kids. And I'm like, okay, I'll do a video. So here's my video. If you want to come see me and find out what we can do for you or your child, then give us a call. It's 303-427-5000 and give you a free consultation and let you know what the scoop is. So thanks for watching and have a great day. Bye. We got to get our on-air sign.
Yeah, we do. And that's Susan.
Who was it?
Susan.